Everything is fine. So, Dr. Svatek, can I call you Mandie?
Yes,
All right, I like that better. Okay, so Mandie, can you tell me what it is that you do?
I am a pediatric hospitalist with UT Health San Antonio, an associate professor of pediatrics, and I also am the chair of the South Texas Asthma Coalition. I serve a few roles, and then the Asthma as the Kids Breathe program through Metro Health. I serve as a medical advisor for that organization.
Oh my gosh, I'm surprised you had a Saturday off.
Well, we're not doing much these days, right? We're staying at home when we're not working, and so we're figuring it out. Yeah.
Yeah, I know pediatrics is your specialty, and along with all the other things you enumerated, and it's really amazing all the things when you have kids coming up, they're going back to school. Thank God my kids are out of school, but when they were going to school, I remember inoculations and this and that and all kinds of other things they had to come up with, and especially when they were younger. So, what advice do you have for parents who are anguishing over sending their kids back to school, and what precautions should they take, perhaps?
Right. This is an extremely tough decision. Me as a parent, me as a pediatrician, and the information that we have coming in, it almost feels like on a daily basis. So, I really am concerned and understand when, parents are having to make this decision, even, teachers having to make this decision to have students come back to their classroom. And I think the most important thing is that, needing that information, needing to be informed in the best way possible. And yes, things are going to be changing sometimes on a daily basis. And so really continuing to be informed and being notified of those changes, and then having some sort of standard of metrics to follow so that they can help make that informed decision the best way that they can. Meaning, if showing the metrics are showing that we're in a safe zone, then that might support their decision. What also supports their decision is just based upon what's happening in their lives and their families as well. And so it really becomes multifactorial, but if you weigh in what's going on in their lives and then knowing what they have as the metrics, the standards that the city is helping set forth, Metro Health, and then what the schools are doing and how they are informing them about what is going to be the best time for these children to return. I think that's what these parents need to know.
Yeah, I'm probably going to be unpopular when I say this, but I've never been one of a fan of the independent school districts. What do we have? 25 of them, however many we have in the city, and so each of them get to do their own thing as far as precautions and things and advice they give parents who are returning to their campuses or whether they're returning or not. But it just seems to me that every day, first the kids couldn't get it, and if they did get it, they wouldn't know they got it, and they wouldn't be sick. But then there were, I don't know, however many thousands of kids that got sick and got really sick, and that, threw people up in arms. And then there was classroom inside and there's classroom outside, and there's just so many different things. And you spoke of standards, and I know Bear Metro, and I know the city is trying to do what they can, but a lot of things are governed by governed. What I play on words are dictated by the person who is in charge of our state and then the executive office for the country. So how is it? I mean, how difficult is it to create standards? And you got to have all of those different fingers in the pie, so to speak, that you have to take into consideration when you are trying to figure out the best advice for parents and children.
Right. So it definitely starts with the Center for Disease Control, the CDC, which everybody hears about. And so, and it is a tiering system. So what the CDC puts out to the entire United States, and then what each state does with it, and then what each city does with it. What's important to know is that yes, there are going to be a lot of variability within San Antonio. There is a pre-K through 12 consultation group, which I serve as a member on, as well as many other individuals, whether it be parents, teachers, clinicians, public health specialists, and they take this information and really sit on it and try to develop the best advice that we can give to each school district to practice appropriate measures. And I think, and the district leaders are also serving on this consultation group. And so it's important that, yes, there are some decision making at a higher level, but when it comes down to us, it's important that we look at it and we understand, we have to be the ones in the city to kind of stand up and be involved to create these safety measures, because we know that there's a lot of weight, that families are depending upon, the individuals that are putting their minds together here and putting their input and putting their concerns to make those decisions the right way. Because, yes, you're right, children aren't immune to COVID. And fortunately, the mortality, the death rate is extremely low, less than 1% of the population. And so if we think about the flu has more major effects on children than COVID at this point.
At this point, yeah.
And then we have outliers, though. We do have those cases where some kids are severely affected, and then we have the inflammatory system syndrome that can present post-COVID. So there are a lot of things to factor in to think about. So that's why it's important to be informed the best way that you can, and then to make sure that you have leaders that are involved.
Well, that's great. I really appreciate there's a couple more committees you just named that you were on. I really appreciate all of your hard work because it is sorely needed. But so one of the committees you're on, or one of your responsibilities has to do with respiratory conditions and asthma and the like. So are there any special precautions that kids who are suffering from respiratory conditions or asthma or something along that spectrum?
Right. So we do have to think about children with other health problems. And one of them, potentially, what the World Health and the CDC has stated is that, children that have comorbidities such as heart problems or respiratory problems can be at higher risk, or even neurologic problems can be at higher risk for developing worse disease with COVID. That being said, right now, when we look at the data for patients, children with asthma, we aren't seeing them necessarily show up or be sicker in the hospital. But this is not over yet. And there is that potential for return to school and potential for increased exposures. Then we're going to be collecting more data and trying to see what that data shows. For our respiratory population, the biggest thing right now that I've been enforcing is really those that are on nebulized therapies. We need to take a step back because we want to, and if those children are returning to school and they're using nebs, we really want to reduce the transmission. And so one of the things that hospitals have done is for COVID patients that are requiring any sort of nebulized therapy to actually convert it over to an inhaler, a meter dose inhaler, MDI. And they give the treatment via that way. So that way, if a child is potentially asymptomatic but is positive for COVID, but they're using a nebulizer in school, they could potentially spread that to somebody, and then that person becomes symptomatic. And so it's important that those that are using nebulizers have the ability to switch over to a inhaler with a spacer. And if they're younger or can't use that spacer appropriately, the spacer can actually attach to a face mask. And that face mask creates a nice seal against the face that they don't have to necessarily be cooperative with. They just have to breathe in and out, and once that person has a good seal, they can get their treatment. So, those are other things that you have to think above and beyond, especially, if we're thinking about peering in, kids with special needs, first and foremost, because that's where the resources are, and getting them back to the school first. A lot of them may need to transition those nebulizers to MDI.
Wow, that's so. Now, when you talk about the inhalers, how easy are they to come by?
They're actually easy right now. We were talking a couple of months ago about there potentially being a shortage of the albuterol MDI. That's the biggest one that's the escape inhaler.
Right.
Being a shortage because it's a high number of COVID patients were pediatrician and get that prescription and get, if they're an asthma patient, get an asthma action plan that shows that they can use this and teach them how to use this appropriately, and then get them back to the school nurse. And the school nurses really do know how to use those spacers.
Oh, absolutely. Yeah, I've seen that before. Absolutely. Yeah, no, I chuckled when you said whether they're cooperative or not, because I have seen them where they're not cooperative, and it's interesting. So at least you know all of the angles. So for youth, for kids, let's say that are like K through 6 or whatever, should they wear a mask or not wear a mask?
They should absolutely wear a mask. It's extremely important. They should wear a mask. They should maintain 6 feet of distancing, and they should wash their hands frequently or use hand gel. Those are really the vital things with getting back to school that we really need to be in the habit of even before we go back to school. And so, if you teach them how to wear a mask at home, they can do it. We have oncology patients that are 2 years old that wear masks in the hospital because they need to protect
themselves. Right.
Yeah, and so they have the ability to do that. And so, you can teach them. They can do it, and teaching them about the distancing. That's really important too, and it comes with practice. And so, practicing those good habits before they get back to school can be key.
Awesome. Now, one I read somewhere about there was a little YouTube video on it that kids that returning to school, especially the younger ones, where there are more germs spread, so to speak. That when they return home after a day at school, that they should immediately, like in the garage or a wet room or whatever you want to call it, disrobe and shower. Is that something that's required, do you think?
So if children are actually sick and if they get home, they should, or just any child should disrobe.
Okay, awesome. So that's another one that we have to.
No, sorry, I was trying to clarify your question.
Oh, yes. I mean, should they disrobe and wash what they wore for that day and clean themselves or shower, whatever they need to do, or is that?
Is it any child?
Yes, any child.
No, not necessarily. Now, if there is that concern for potential exposure, they have a positive case and they were in that classroom, then taking those measures, just like healthcare workers have been advised to, can be, an additional added thing, especially if we know that these children are coming home to multi-generational homes where they have, grandparents with other comorbidities, diabetes or other health problems. Then we can take those precautions if they've had an exposure.
Okay. And we have there is a unified way of reporting those, correct? At schools?
Yeah, at the school, at reporting the cases, yeah, as mental health works on the testing and understanding the positivity of that, it's also that the schools are working on those links to get that information back. And, most of the schools are going to, I at least know for Northside, are going to be, asking those daily questions. Do they have symptoms? Or is there any concerns? And if they do have symptoms, they need to get tested. And if they are positive, then that school needs to be notified immediately. And so I think the districts are working on those measures so that they can get those notifications.
Awesome. And flu shots for everyone, correct?
Flu shots for everyone, correct. It is really vitally important because what they are seeing perhaps that this might be an aggressive flu season. One thing that's important is if everybody's masking and distancing and washing hands, that alone might help in reducing this severity of what we think is coming in. But most importantly is getting that flu shot because we don't want the number of cases of flu coming in plus COVID coming in on that and really, taking our hospital resources to another level. I mean, with this last spike, there were concerns about our resources and what patients that we could help more over others, and that should never be the case. And so we don't want to have that where we're having high number of COVID cases, high number of flu cases stacked one on top of the other, and then the hospitals having to make decisions that they shouldn't have to make. So flu shots for everybody.
Awesome. Thank you. Thank you. Thank you. You are such a wealth of information today. So I'm going to switch a little bit. This might be a little bit outside of your specialty, but any advice is helpful. So there are this whole big controversy about sports, male and female sports in schools. Some schools have started playing football already here in outside. I guess there's some of the Catholic schools or independent schools have already started, and they have opened with football. And what are your thoughts on sports, contact sports?
Right. So, again, it's using a metric system. Um, so, so we're collecting data from other schools right now and seeing as they open back up, what's happening, and then we're collecting data from, other organizations as they open up contact sports. What's happening with them, even before our public school districts here in their county open up. I think if you have those disease activity level of determination criteria, so you're talking about, the number of true positive cases for the past 14 days, if you're talking about disease doubling time and daily number of cases over a 14-day period, if you're working on that system of, hey, if you're in a zone where you have these factors that show you that they are better than even what we're seeing with hospitalization rates, and they're tying in all these factors, then maybe it might be a time to open up the contact sports. Right now, as far as the metrics and what they determined to use, so the percent of positive COVID cases, the disease doubling time, the daily case numbers over a 14-day period, hoping that they all decline. Now, if all of that's happening and you get into what we determine the green zone should be, it might be okay, right?
Right, right.
But if you're not there yet, then it is a stress, and then you wonder, are you going to get a spike, and other people exposed that shouldn't be exposed. So you have to be extremely cautious, but I think following a metric can help you with that, and that's what I always try to enforce. Anything that we do is follow your metrics that can guide you in making those decisions.
We ought to put you in charge of fixing this thing nationally. You've had, those are the types of guidance you think that we would get universally, but it doesn't seem to be that way. So, and when do you really think, realistically, when do you think we will be able to get some type of a vaccine, and how readily available will it be?
Right. So if I talk with some of my colleagues, probably somewhere mid 2021 might be the time. What we're hearing a lot about is trials going on, even trials in Russia that are going on with individuals before they did other tests. So it gets a little nerve-wracking. And, you hope that they're doing things in a sequential fashion here and not rushing things. I think, you have really smart people that are really focused and put a lot of things aside just to work on that vaccine part.
Right.
And so we need to see, once they're ready, hey, what have you done? And what have you studied? And you've studied it on, the animal model. And then now have you studied it on a small group of your population? And, there still can, in fact, even beyond that, be some uncertainty. But, I'm hoping, mid 2021, hopefully maybe a little bit sooner. I think to think that before this year ends is a little ambitious, but knowing that people are working on it, I think is important, and knowing that we should reach that point sooner than later it's going to open up a whole new world for us, and so I'm looking forward to definitely having that here once it's here, and assuring hopefully that it is safe.
I have two more questions for you. We're almost out of time. I think I got enough to get two more in. So the first one is let me think of it. It's some type of a new test, like a ready test that people can take, and on the spot it gives you a result. That I think one of the professional leagues, I want to say it's the NBA or NHL, one of those leagues used it to. That's how they monitor their players on a daily basis. I heard that's, or at least the rumor is out that that's going to be something that's available to the public. Would that be something that would be helpful?
That I have not read about yet or been informed about, but that's okay. I'm not completely informed, and I'm okay with that. But what you have to do is, if these tests come out, you need to look at what's called the sensitivity and specificity of the test,
Okay.
and ensure that those percentages are, almost 80% or above. And then, of course, when they get those percentages, have they been tested appropriately to get those percentages?
Right.
So that's what I'd like to see before, we start using a test that really isn't valid or has a good sensitivity or specificity to it.
Thank you so much. Okay, last question. I promise, last question. So you know, everyone's got to make a buck. I'm not going to make a comment on that, but so more and more places are opening, and for whatever reason, some successful, some not successful. But it seems like now one of the universal things that are going on is people are taking temperatures as patrons or customers walk through their doors, and they're giving them hand sanitizer. How is that? Is that an effective preventive measure, or is that window dressing?
Yeah, we have to think about COVID and there being multi-symptoms, and knowing that somebody may not have fever right at that moment. And you have to depend upon your population really not going out and assuring that they're quarantined. But if you have to do some sort of measures, then, it's okay to get the temperature, and it's definitely okay to enforce, wearing that face mask, hand washing prior to entering, trying to reduce those risks. But I think the best thing is informing the population if you're even remotely sick, and it could be that you're only having respiratory symptoms or you're having GI symptoms, plus minus fever. You have to put all those together, because we know our pediatric population may not be presenting with fever. Our adult is a lot more prone to present with fever. So they have to have some sort of standards to kind of remind people before they step in to their place. Hey, are you doing the right things? Let's assure that we're at least taking a temperature. Let's assure that we clean our hands appropriately before entering.
Awesome. Thank you so much, Mandy. You have been so very awesome. It's taking out your time away from your kids on a Saturday. I really appreciate it. Go back and take care of your adorable kids, and thanks for your time. Thank you for all of your work that you're doing in the community, and we will overcome this together.
Yeah, we will. I think that's what's important, is that we need to do this together. We need to stay positive. And a part of one of my goals when this first started was, how can I be involved to help the city that I grew up in, help the city that I love, and to help the underserved population. And I think this is what we need to do. We need to get out and educate and give them tools and help our people the best way that we can. So thank you for this opportunity.
God bless you. God bless you. God bless you. I mean that from the bottom of my heart. Thank you so much. Dr. Mandie Svatek, she is the Associate Professor of Pediatrics over at University Health Systems. She's been with us today, helping us to learn more about what we need to do to make sure our kids are safe as they go back to school. So you make sure you make a copy of this and keep it somewhere where you can put it on your phone and use the tips that she gave you, because they are very helpful. Thank you so much, Mandie. Have a wonderful weekend.
Thank you. You too.
KRV FM, the Heart and Soul of San Antonio. This is the Dr. Doug Inside Saturday Show, and that was Dr. Mandie Svatek. She is, once again, the Associate Professor of Pediatrics at the University Health System, talking to us about things that we can do to help protect ourselves and our loved ones from the COVID pandemic and the upcoming flu situation that's going to be here before we know it. So here we got Dr. Doug here with them here till 5, and let's see what we're going to come up with next and figure out something that we're going to play here. And yeah, I'm just checking the weather here while I'm talking here right now. It's 103 outside here in San Antonio. Wow, it's going to be hot for the next several days. So make sure that you stay hydrated and you get everything that you need done. Dr. Doug here with you, KRV FM, the Heart and Soul of San Antonio. A little Athena Renee, rock with you.